and welcome to this edition of Health and to bustling London. So far in Europe, Britain has borne the brunt of this new flu, influenza A, with England recording over 100,000 new cases within the space of 1 week earlier this summer. Since then, the numbers have fallen, but as schools reopen their doors, many fear that this virus could flare up again. In this edition, we'll be catching up with the new flu and looking in particular at whether or not the vaccination they're making is really safe. But first, using London as our laboratory, we're now going to meet with a flu hunter, a flu victim, and those at the front line of flu treatment. Inside this 1930s building in northern London is the flu, from all around the world. It's one of 4 WHO influenza centres. Rod Daniels is the flu hunter. He's studied the virus for over 30 years, looking at its makeup in order to understand its potency. This morning, some new samples have arrived, packed in dry ice to prevent the virus spreading.
Iceland with 4 seasonal H1N1, 27 pandemic H1s.
Daniels keeps a close eye on the flu every year, concocting the recipe for vaccines. But in a pandemic year, his eyes are firmly fixed on watching for changes.
This virus is not that aggressive at the moment. Who's to say it may not get more aggressive as it changes? Because as well as the hemagglutinin, which we follow from a vaccine point of view, there are 7 other genes in this virus. And we know currently that there are certain positions or mutations in those other genes that do not necessarily make this virus as fit as it could be in terms of being a pathogen for humans.
So far, so good for man, if albeit a little disappointing for the scientist, who would be interested to see more of a shake-up. Daniels, however, will follow the new flu over the next 3 years, trying to stay ahead in order to ensure that medication can be made to measure. But even 21st century biology can't predict the flu. Scientists can only make educated guesses. They fear a surge in cases in the north as winter hits, but admit they're surprised that this virus hasn't prolonged the flu season in the south. The only real-time laboratory is the human population itself. 29-year-old Gabrielle Bussell is back at work and feeling fine, but both she and her fiancé Ed came under attack while enjoying the Glastonbury Festival, and within a few days they had become flu victims. Not always mild and definitely miserable for those who've caught it. Gabrielle remembers having a temperature of 38 degrees on London's hottest day. Anyone who thinks they have the flu are advised to stay at home. Gabrielle was diagnosed by her doctor over the phone, and despite being prescribed Tamiflu, the virus put her in bed for over a week.
Really, truly horrible, like flu, but the worst flu I've ever had, with vomiting, diarrhea, dizziness. I was on the Friday, I was sort of standing up and nearly passing out. Hacking cough, really bad cough.
4 or 5 days later, suddenly realised, sore throat, cough.
Hacking cough.
Well, I phoned my doctor and explained the situation, explained that Gabby had swine flu and had already been prescribed Tamiflu. My doctor phoned me back an hour later and asked me the symptoms and said it sounded like I had swine flu, and that although I wasn't as severely affected as Gabby was. So apparently I didn't need the Tamiflu, but that I was to stay in bed and
keep away from people.
Just waiting.
With the virus now behind them, this couple hopes they're immune to the new strain of flu. And with their wedding still a few months away, they already know they can be together in sickness and in health.
She said everyone's been really appreciating that.
The Tamiflu distribution centre in the East End of London, the front line of treatment in a neighbourhood that at one point had the highest level of the new flu virus in the UK. Determined to keep its image clean, Mike Curtis from the Communication Centre gives us a short and strictly guided tour of the site.
We're now into the reception area. This is where people will come, either with their prescription, where they will be registered. We have divided this centre into 2 zones. The first is the blue zone, and here in the blue zone, the flu friends would be welcomed into a waiting room just like this one, where they would wait for consultation with clinical staff. Further on down this particular corridor, we have what we call the yellow zone, And the yellow zone, this is where people who actually have swine flu wait and are seen by consultants. And further on we have our administrative area, and this is where we keep our stocks of Tamiflu.
Here, the antivirals are handed out to anyone suspected of having the virus. In order to minimise infection, people are being diagnosed over the internet. The wide distribution could eventually encourage resistance to the treatment. Nurse Leslie Collins has manned the station since the start of the pandemic. Over the past week, she's seen a daily average of 30 patients come here to collect antivirals, a sharp drop from when the centre first opened its doors.
I arrived in June on day one of our opening, and at that point we were seeing 300 people per day. My role would be to assess patients who may have flu symptoms, or to issue Tamiflu to a friend or a relative of someone who has symptoms and they have stayed at home to get well.
This neighbourhood has a large young population. Across the country, the flu hit younger people at higher rates than adults. And indeed, babies are among the most vulnerable. Infants under the age of 1 are more susceptible to infection than others. Richard Halverson has been a GP in London for the past 20 years and now runs a vaccination centre called Baby Jabs. Over the summer, he's already seen a number of babies with the flu. Never fun, especially as infants can't tell you exactly how they feel. But at this centre, no jab is given without thought. 9-month-old Madison is here for a polio vaccination. Her mother wouldn't even think about giving her the swine flu shot.
No, I wouldn't. It's come out too fast, and I don't believe it has been thoroughly tested.
An opinion that's shared by Dr. Halverson, who stresses that so far the virus is mild, so for him, even though babies are vulnerable, there's no need to vaccinate. He also strongly advises mums-to-be, who are more at risk to suffer complications, to think twice before taking the jab.
In general, we like to avoid giving any sort of drug, including a vaccine, to pregnant women unless it's absolutely necessary. At least one of the swine flu vaccines will contain mercury, for example, which is a very toxic poison that has been removed from all routinely used childhood vaccines, but nevertheless will be in the swine flu vaccine. That is a potential neurotoxin, and I couldn't advise any pregnant women to take a vaccine with any mercury in.
Some clear recommendations for worried parents as the first of the flu vaccines are made available. A vaccination for the new flu is one of the big questions currently being posed. Never before has the pharmaceutical industry been asked to make such high quantities in such a short space of time. Worried about the speed with which things are being done, up to a third of doctors and nurses here in Britain say they don't want to be the first to accept this new vaccination. Well, we've come to the offices of British pharmaceutical giant GlaxoSmithKline to find out a bit more and see whether you should take it or leave it.
Working round the clock to pump out the vaccine, pharmaceutical companies across the globe are going faster than ever to produce the new injection, a new jab for the new flu. But they say that years of experience means their speed isn't impinging on safety. In the Northern Hemisphere alone, governments have ordered 1 billion doses. Supplying the vaccine in bulk, British company GlaxoSmithKline. It's adding ingredients it would otherwise avoid, such as mercury.
We have been trying to reduce the amount of this compound in vaccines. Now, however, for the pandemic vaccine, because it is being produced in a large bottle, and doctors will have to put syringes in and draw out as they need it, we need to have that preservative.
The company underlines that the quantities are so small that there's nothing to fear, but some doctors remain unconvinced, saying that normally it would take over a year to produce a new vaccine.
Vaccinations are made to have an effect for life. So if they can bring a lifelong beneficial effect to the immune system, what proof do we have that they don't have a negative or non-desirable effect on our immune system too? Vaccinations are medication that should be checked more than other medication, but which have always been rushed in production, and that's a risk for public health.
Clinical trials for the new vaccine are still ongoing, but orders from countries in the Northern Hemisphere have so far topped 1 billion doses. It'll be up to each state individually to decide when and whether to use them.
And finally, before we leave you, it's now time for something strange but true. Welsh whiskey to ward off the flu. Well, that's the advice being given to Russian football fans travelling to the UK to watch the World Cup qualifying match. Russian authorities would prefer that its citizens boycott Britain altogether at the moment, but the Football Supporters Association has advised that any of those who can't miss the match drink heartily while they're here. It's advice doctors would no doubt debate, but there you have it. That brings us to the end of this edition. I hope you enjoyed and found it useful, and I'll see you again next time.